First, the state of Canada's vaccination effort. In the last 24 hours, the share of people over the age of 12 with one dose reached 80%, and just over 60% are fully vaccinated. That once blistering pace of first dose vaccinations has now slowed to a jog. More than 6 million eligible Canadians have opted not to get the shot, at least for now. Public health experts suggest Canada should strive for 85 to 90% coverage to be safe. So how do we get there? Patty Hajdu is Minister of Health. She's in Winnipeg. Minister Hajdu, welcome back to the show.
Thanks for having me, David.
So tens of millions of Canadians have gotten their vaccines and are even fully vaccinated, but we've got 6 million eligible Canadians who have not even received their first dose. We're seeing the Delta variant just ripping through the United States. How worried are you about this big pool of Canadians who don't seem eager to get vaccinated?
Well, David, obviously I'm worried extremely significantly about their own particular health, but of course we also know that unvaccinated individuals can drive a surge in a community, especially if there's low vaccination rates overall in that community, and create the kinds of crises that we saw in our healthcare system through the previous waves. So Health Canada is working diligently with partners like provincial and territorial governments, but also right here on the ground with community-based organizations to break down some of that hesitancy and help Canadians accept vaccination as a way to protect their own lives and their own health, but also to protect the vulnerable people in their lives.
Well, what sort of a risk does a cohort of 6 million unvaccinated adults, or over 12s at least, present to the country?
Well, again, you might have a community that has a really high rate of vaccination and therefore obviously better resilience if the virus is introduced from a variety of different ways. But if you have a community that has a really low rate of vaccination where there are, a number of people unvaccinated in high percentages, that of course puts everybody at risk in that community. And of course it puts the healthcare system at risk. And ultimately at the end of the day, as we've discovered painfully now, globally and here in Canada, it puts the economy at risk. I was downtown in Thunder Bay, Ontario, where my riding is, just a couple days ago, visiting with the small businesses that are opening up, that are starting to see a resumption of traffic into their shops, and they're all so hopeful that they are going to be able to remain open, and many of them talked about how they just won't be able to sustain another closure, and that's what we're protecting here. We're protecting people's lives, we're protecting our healthcare system, and of course we're protecting Canada's economy.
You mentioned earlier that you're working with groups to break down barriers with vaccine-hesitant segments of the population. I wonder, what insight do you have into who these people are who are either not able to get vaccinated yet or simply refusing to get vaccinated?
Right, well, there's a number of reasons, David, for hesitancy. Of course, there's those folks that are very hard to convince, the people that firmly believe and have fallen prey to misinformation online, for example, that are adamant that they will never be vaccinated. And those people are very hard to convince. But there are a whole bunch of people that are hesitant for other reasons, and it might be cultural barriers, it might be language barriers, and it might be other kinds of challenges that they're having in getting information or feeling confident to make that decision. And that's why the Government of Canada launched some months ago the Vaccine Innovation Challenge. Here in Winnipeg, for example, I just met with one of the groups that's been successful. It's the Women of Color group here in Winnipeg. They work with community, with the Canadian Chinese community, to provide information in Mandarin and in culturally appropriate ways that helps people feel comfortable getting vaccinated. And they talked about the hundreds of people that they've been able to support to feel safe and comfortable to do so.
So is that the plan, to sort of identify specific groups where vaccination rates are low and then sort of micro-target them through various outreach initiatives? Is that the best way to get to these 85 and 90% vaccination numbers that the experts say we should aim for?
It certainly is one of the ways to increase vaccination, is to understand that people sometimes need information in more culturally specific ways. It reminds me of when I worked in public health, many years ago, but I spent about 9 years with the Thunder Bay District Health Unit, and I learned about health promotion, in particular about how sometimes we do health promotion through a very Eurocentric perspective that doesn't resonate with other groups. But it's not just necessarily cultural. It could also be, for example, the kind of sector that someone works in. We're working, obviously, the Innovation Challenge has projects that have been funded with Indigenous groups, with labor groups, with trades groups. It's really interesting to see the number of people that have stepped up and said, let me help educate and support people in my community.
You know, you look at some of the provinces, Alberta and Saskatchewan, they have the two lowest percentages of first dose coverage. But even here in Ontario, where first doses are at 80%, you have some of these public health units that are as low as 60 to 62%. So what do governments and public health practitioners need to do to reach people?
Well, again, it is persistence, and it is really segmenting audiences, and it's working in a respectful, collaborative way with community groups that have the power to reach more deeply into those groups, to be able to provide information in ways that it's going to be more effective at talking to those particular Canadians. And again, we rely on community partners to do this kind of work at the federal level. I'm in Winnipeg today, for example, talking about substance use programming. It's the same idea that we know community-based groups are doing really important work. They have those relationships. They're more able to have those conversations that are not so broad and general, but are much more customized.
But Minister, when you look at the daily vaccination numbers, I mean, we're still making progress overall as a country, but first doses in particular has really dropped and almost flatlined in a lot of places. So what do we do if these 85 and 90% targets that Dr. Tam and others talk about wanting to hit, if it just flatlines and we're not going to get there? Because there's been a lot of carrot talk to this point with incentives. When do you switch to stick talk to try to start really forcing people to go get vaccines?
Well, first of all, I just want to congratulate the immunizers and the Canadians who have stepped up to get vaccinated, because although we're talking about the unvaccinated right now, in fact, Canada's rates of vaccination in some ways are doing better than many countries around the world. And so we have to acknowledge the success that we've seen in communities, and that Canadians have stepped up in droves to vaccinate themselves, to protect themselves, their communities, their children, other groups that can't get vaccinated. But absolutely, we have to stay focused on those folks who are not comfortable getting vaccinated, who haven't chosen to get vaccinated yet. The provinces and territories, as you know, are responsible for vaccination and for the healthcare delivery systems. We support them, as you know, by, for example, purchasing and buying all of the vaccines, the additional support that I've talked about today with the vaccine challenge. But ultimately, at the end of the day, this is going to come down to community and provincial level decisions. Some universities and colleges, for example, are insisting that students be vaccinated before they return to school. In my own community of Thunder Bay, that's the case. So we'll start to see those kinds of decisions being made at a variety of different levels about what kind of risk community groups are willing to take, what kind of risks different sectors and systems are willing to take. And of course, that will add additional pressure for individuals that if they want to participate in those settings, they'll have to be vaccinated.
So, Minister, one other topic, if I can quickly ask you about it before we let you go, is the whole idea of not a vaccine passport, but vaccine certificate for international travel, proof of immunization. Conversations going on with G7 and G20 partners, and it hasn't been finalized, even though the U.S. travel is being allowed. When are we going to see that? How close are we to having some sort of final decision on what proof of immunization will look like for international travel?
Well, thank you. My colleague Marco Mendocino is leading this file on proof of vaccination for international travel. And of course, we've always said that we want to make sure that as international travel resumes, Canadians have the right tools to be able to participate. That's why, of course, we've been working really closely with the provinces and territories. Again, in a federation, provinces and territories own that health data. Privacy will always be paramount, both to the federal and provincial governments. And so we continue that work with the provinces and territories to figure out a system that will provide that verification by Canada, or a standardized format that will be accepted by our international partners. Okay,
but do you have a sense of a timeline of when we might see that? Or should I ask Mr. Mendocino?
Well, again, this work is ongoing. Of course, the data is owned by the provinces and territories. So a lot hinges on how we can get that data to be provided in a standardized format, or in some cases, approved in a standardized format in a way that, again, puts privacy at the top of our considerations.
Okay. Minister Hajdu, thank you so much for your time.
Thank you very much, David.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.